Hello and welcome to the Pre-Chiro podcast. I'm your host, Dr. Ben Glass, and today we're making a professional chiropractor connection with Dr. Liz Anderson Peacock. Liz, can you get us started by just introducing yourself and reflecting on what it was in that time of life that attracted you to become a chiropractor?
Okay, well, thank you, first of all. And you know my name. And I've been a chiropractor for 38 years. And I guess when you add another four being a student and then university before that, I've been exposed to chiropractic for over 40 years, which has been phenomenal. And it was an interesting, there was now a confluence of many things that brought me to chiropractic. One was I really didn't know which part of health sciences I wanted to go into. So I was really observing my friends that were going into different professions like medicine, dentistry, things along those lines. And I had a few friends from high school that went into this thing called chiropractic. What the heck is that? I've never even heard of that before. And they were telling me all about it. And I was like, wow, how come I've never heard about this before? And like many things, if it's not in your awareness, you don't see it, then all of a sudden it went into my awareness, seeing these different chiropractic offices and shingles whenever I'm out, which again, they were always there, but never had noticed. So that was kind of an interesting thing. And I was on scholarship doing a Bachelor of Science, and I was very interested in structure and function and advanced vertebrate morphology and things along those lines, and dissection and sort of the sports medicine, neurology. Those were sort of the interests that I had. And it was really interesting in observing my friends that went into the different professions, and I was really quite shocked with how my friends that happened to go into chiropractic, they were talking about whole body and they were loving what they were doing, and they were getting their hands on palpating people and looking at how things were working and not working, and how structure and function and physiology was adapting to whatever was going on with the individual. And that really made me more curious as to what chiropractic was about. So I did a little bit of fact finding on it, which was very uh, difficult to do back in the early 80s at that point. And well, actually, late 70s is really when it was. And then, lo and behold, I injured myself, and my perception of chiropractic at that point in time was you went in for back pain and neck pain. And so I went to see a chiropractor and flipped my world upside down when I was least expecting it, in the way that there was a whole body approach for a specific problem. And I think that there were sort of three things that really struck me with that appointment. One was she absolutely looked at the chief complaint and was looking at what was going on with that, did a history and an assessment, but then explained to me why she wanted to look at the full spine, because everything was interconnected. Made sense to me. And without knowing my history, as she's palpating my neck, she started asking me these questions where I'm sure my head like started turning around, like, how do you know my health history? And it was things that I'm like, what the heck does this have to do with chiropractic, let alone my low back pain? And the thing that really struck me was the questions on when I was a little kid, did I have any injuries and falls that I was aware of? And I'd had some significant ones, like a car accident with two black eyes. Back then, you didn't have car seats, you didn't have seat belts. And I remember my eyes as a kid getting checked, but never my neck. And just numbers of competitive sports that I had done. And I was a rough and tumble tomboy. So that was, first of all, something of a great interest. And the second thing was where she was palpating in my upper cervical spine. She'd asked me if I'd ever had any issues with things like environmental allergies or sensitivities, asthma, anything along like that. And again, my radar just went right up, because I had had quite severe allergies that started when I was about 6. And I had 10 years of allergy shots to no avail. And I remember as a little kid, I used to wake up and in the hay fever season, I had a glass of water beside my bed, which had an air purifier in it in the summer season. And I remembered it was either Dime Tap or Allerest that I would chew a pill, not both, but one or the other. And I remember thinking, if I take this pill, then I'll be healthy and I'm great for the rest of the day. Not quite in that language, but as a little kid, you're interpreting it that when I eat this, I'm going to be healthy. And when she's asking me about my allergies, I'm like, what the heck does that have to do with my neck? And so she said, her perception was it wouldn't be a surprise if I had a lot of sinus issues and I was overreacting to the environment. And I'm sort of like, well, I have no idea what you're talking about. And she said, let me give you an example. If you and I are breathing the same air during pollen season, would you agree that both of us are experiencing pollens at the same time, similar pollens? Yes, of course. It's not like all the pollens are going just to my nostrils and not hers. So that made sense. Yes, we're both experiencing the same stressors from the environment, is how I would word it now. And then she said, well, if, and are pollens sort of naturally occurring in the environment? Yes, they are. And then she said, well, if pollens truly were the cause of allergies, then why wouldn't everyone that's experiencing the same pollens at that time have the same allergies if they were the true cause? And that was the big light bulb question. And I had to say, I don't know. And then she said, well, would you entertain that perhaps your nervous system is over responding to the environment, thinking that the pollens are a foreign invader, instead of picking a more appropriate response and just, every once in a while sneezing, getting them out of your nose and not reacting to them? And I said, that makes so much sense to me. And I said, what does this have to do with chiropractic, right? And it was really that extra little piece of understanding that I had had a problem in my neck that at that point in time had created, I'm not going to put an irritation, but had changed my ability to adapt to my environment in an ideal way. And my body was expressing in an adapted way to foreign invaders, in this case, pollens. And that the chiropractic premise was really that the nervous system is the master controlling system of the body. Interference with the nervous system can change how that body may interpret and or respond to the world. And with certain injuries, in my case, certain falls and some lifestyle things, I had become predisposed. So fascinating for me. Had my first adjustments. Yes, the low back improved pretty much immediately. The allergies were improved by about 80%, like instantaneously. And I'm just like, okay, that's what I want to do. So there's my story as to why I got into chiropractic.
Absolutely amazing story. Can you maybe just touch and tease apart some of the details of your upbringing? You said that you were involved in a lot of physical sports, and maybe just how your upbringing, you also mentioned that you had an interest in some of these advanced sciences and neurology. And I'm just curious, like, where you were at in life when you had that experience with the chiropractor, and how things changed for you. Just illustrate a little bit about what your pathway was like as you entered into the study and started on the path to become a chiropractor once you decided this was the direction you wanted to take.
Okay, so I would say when I first went to a chiropractor, I was already in fourth year university, and I had a really big interest in neuroscience, and that was just something that I was very passionate about learning. And part of my, as I said earlier, as I was thinking of neuroscience or something sports med wise, where it's about how the bodies function, how the brain is coordinating everything. So the conversation made a lot of sense to me. And I was pretty much prepared to go into a field at that point. So I put my name forward. I wrote my essay as to why I wanted to become a chiropractor. I had good marks. Of course, you never know until you know. And did my interview, and lo and behold, got in. And for me, it was pretty seamless, I would say. And my motivation then to go into chiropractic was a few things. One was I loved working with people. I wanted to be of service. I wanted to use my mind and be able to um, sort of, it's like clue at finding out what are the patterns going on for this person, and how do we uncover what's going on in that body for it not functioning the way that it ideally is supposed to. I love the idea of treating things naturally as a first course, a first resource, first way into helping solve people's problems, or helping people solve their own problems is probably a better way of putting it. The physicality of it, I really enjoyed, and it all just really came together. It really came together for me.
So now that you've chosen to become a chiropractor and you go to chiropractic school, If you could take us through that journey, maybe just in a nutshell, what were some surprises that you experienced, some challenges you had to overcome? Maybe speak about the mentors that you had or the specific pathways that you took as a chiropractic student.
So I would say I went in with definitely an open mind and curiosity. And I think that really makes a big difference because you're asking a lot of why questions. Why is this important to learn? How is this going to be applied? Um, you know, why do I need to learn this in the first place? So I went in, especially in the first 2 years, which are all the ologies in the standpoint. It's your basic sciences primarily, and then you get into your pathology and microbiology, and you know, everyone's like a walking disease by the time you feel like you're done with that year. And there's a lot of volume with that. So you definitely have to pace yourself appropriately and recognize that there's always more to learn. And I looked at hierarchying what are the important things that I need to learn now and what are the things I can come back to later, because I just felt I couldn't be the master of absolutely every single thing. So I did the hierarchy piece and I really learned my basics well. So especially the two ones I focused on the most was definitely my anatomy and my physiology, as the two big core things. If I was going to know the most on anything, that's what I really wanted to know about. Because if I understood my normals, I would figure that if I see something abnormal, then I'm going to recognize it. And so that was sort of the first 2 years, because the program I went to was really done in 4 years. The third year, you're starting to get more into the hybrid model of application of clinic physical exam, history physical exam, the actual the treatment protocols that you're going to learning how to adjust at a much higher level. So that was great because then you could sort of understand, oh, that's why I needed to learn that 2 years ago, was to understand what I need to know now. And even components like physics and chemistry, right? Because you're understanding what's going on in the tissue from the chemical standpoint, and the physics of where do I need to be aligned up to be able to palpate and adjust a person, to assess and to deliver care. And then in fourth year, it was wonderful because then it was a matter of you could see the horizon, the end point, and you were actually with real people. And my big thing that I enjoyed was seeing the people. And I certainly stress to any prospective student is before you go in, if you are able to find a chiropractor or many chiropractors to observe with, because some will allow you to. I have in my past clinic allowed a lot of pre-students and then students while they're in school in my clinic. And that is really so very helpful because you learn nuances and you learn that things are not black and white. It's all shades of gray. And the reason why we still have a doctor involved is to discern the levels of what do I need to notice, and what, when I hierarch what I notice, what can I park, what do I need to act on, what do I need to review for the future, what do I need to reflect on for the past. So there's all these different pieces that I think make a big difference. And I had a couple of chiropractors that I would observe with, and in retrospect, I wish I had done way more, because my students that kind of did really, really well seamlessly as they went out of clinic and into the real world, the ones that tended to really observe with a lot of chiros are the ones that came from chiropractic families. I felt like they were just, it was just very seamless for them. For me, it was more of a challenge because I was still trying to prove myself to patients versus knowing that I knew what I knew, knowing what I don't know. Well, not knowing, but knowing to the end point of what I know, and then getting assistance if it's beyond what I'm comfortable with dealing with. So
the profession is very diverse. How can you maybe contextualize like studying chiropractic to become a chiropractor, and then the different options that are available to you, and maybe speak to like what you were attracted to, and when you started up your practice, like what was the vision that you had for it, and then maybe reflect on how it evolved over time and became more refined, or just how you decided to take care of people as a chiropractor?
yeah, so I think I'm going to start with your last question first, is that how I decided to take care of people as a chiropractor is acknowledge what's going on for the patient first, find the right questions that can transform them, meaning they get to start thinking themselves and building a bigger model of health for themselves, then assessing them and looking for patterns. And then I like to communicate as I'm going through the assessment to find the patterns and to sort of join the pieces or bridge the pieces between the history and what I'm physically finding. Then it's a matter of coming up with a plan, and then it's implementing the plan, recognizing and having the conversation saying, because I haven't worked with you before, this is my plan. However, things can change, right? And we deal with that adaptability if we have to, and feedback from you is helpful. And creating an end vision for the patient in the standpoint of what does the patient want to get out of it. Before I would start with patients, so I would always explain to them what I felt my job was as a chiropractor, and that was to primarily assess the spine and the integrity of the spine and how it's functioning, and how I would look for things that aren't moving properly, that are having putting abnormal tension or pressure through the spine. And we use the spine as the gateway into the nervous system to change tone in the nervous system. And so when I first started back way back when in the 80s, it was still a little bit of the bone on nerve pressure or tractioning a nerve, which will have the same impact on the actual spinal nerve. And now we do get occasions where that is happening, but we're seeing more so changes in when we have a subluxation, the neurology is changing, ascending in the brain and then descending down. So really the conversation is tailored to the patient on where they are at, how much are they able to absorb in that moment. I can simplify it, or if I have someone that wants it very technical, I can talk technical that way. It's a matter of being able to communicate in a way that's being understood by the individual in front of you. So that was a little bit of trial and error with that initially. And when I first went into practice, I actually did not know how I wanted to practice. It was just sort of like, I want to see people. And I didn't really realize you should have a niche or don't. And I tended to gravitate more towards the sports and sports sides because of the company I kept. And I will say that I was very academic in my head and not necessarily fluid in my way of communicating. And I had very many painful lessons from that, in the standpoint that I just lost patients. And when I mean lost, I mean I wasn't gelling with them and putting together complete plans. And I remember at one point I was so disheartened because I'd done super well in clinic as an intern and terrible in my practice, that I thought I was going to leave the profession. And I saw this letter that I had, or actually this piece of paper between these books in my library, and I thought it was a piece of garbage. So I pulled it out. And if you can imagine, it was my letter that I wrote as to why I wanted to become a chiropractor. And that was really beautiful and painful at the same time. And it was beautiful because it made me recognize what I wanted to do and remind me. And it was painful because I realized how far off course I had gone and I needed help to get back on course. And so I had connected with a few of my classmates that had been doing really, really well. And lo and behold, they just happened to have a similar coach at that time, who was out of Australia but living in Ontario, Canada, in that time frame. And I thought, I can't afford to do it, but I can't afford not to do it. So I left the town that I was in, which I didn't really want to be in anyways. I moved back to my hometown where I wanted to be, and started having a coach who really sorted me out up here. And before long and short of it, I was busier than stink, and as busy as I wanted to be in a very short time frame, like within 6 months. And then it was basically these children that started to come in, where the parents were bringing the kids in. And I really wanted far more certainty in that. So then I started to take a lot more pediatric seminars. And then I decided to enroll. And at that time, the only diplomate program was through the ICA. And so I was in that first graduating class of pediatric diplomates, and still am very, I'm still involved with that group, because we have to do continuing ed to maintain, maintain the diplomate and things like that. So it was a great journey. I wouldn't trade one thing with the journey, because everything makes you who you are in the moment of where you live right now.
That's amazing. What a story. So you've published books before. What was the inspiration behind that? Like, when in your career did you decide to make that happen? I remember Pearls of Wisdom came out when I was a student, maybe about 12 years ago.
Yeah.
And I'm just curious, like, were you always writing and you decided to put it all into a book? Or was there a central focus behind that? Like, where was the inspiration for doing those types of projects, those creative ones?
Yeah, so the first one I did was through Gilles LaMarche, and he's a really good friend of mine, and he asked me to contribute to a chapter, which I did on the regular office visit, on the things that are important with that. And I loved the process, and I thought, this is kind of interesting. And then at that point in time, back in 2009, 2010, there were not a lot of female speaking chiropractic females speaking on the circuit. And I just knew these incredible chiropractic women. And I actually had an injury. So I had blown out my ACL and medial meniscus from a fall down sort of a rock cliff, and landing poorly. And I thought, well, I've got some time as I'm having reconstructive knee surgery. So let's get this book done. So I literally called about 15 of them, and I gave them a very specific time frame. It wasn't going to be a year, because I knew darn well that if I gave people a year, it's at the 11th month is when they start writing. So I said, okay, let's look at, I think it was 4 months or 3 months. And 4 or 5 of them said they could not commit to the timeline. And I was so happy they said that. And I know how hard it is for people to say no. And I truly respected them for not, for saying that from the get-go. And then the rest were a matter of, it was really around the solid point of, what do you think is most important as a chiropractor, as a female chiropractor? And so there was all these very different flavors of chapters. And how I looked at it, and why I called it Pearls of Wisdom, was because when you look at a pearl, how a pearl is actually made, it's made because there's some irritant that is, of course, in the oyster. And so through this irritant, this stressor of the oyster, over time, you have this buildup of this pearl as a byproduct. And so the idea is let's look at some of the challenges that people have had and how you've navigated through it that other people can relate to. And and it went from there. So that was really a fun project, a very positive project to do.
How has women in chiropractic's presence on the teaching circuit, or just their influence within the profession, shifted over the last 5 to 10 years? Like, maybe just speaking to that young high school student or college student or career changer who's in their 30s or 40s, and they're just now entering into chiropractic school. They decided they wanted to be a chiropractor. Like, maybe speak to some of the unique considerations of being a woman chiropractor, and then also maybe just the opportunities that exist from your point of view.
Yeah, so there's sometimes a physical limitation with sizes of people, right? Because you have a small woman and you have a really big person, you have to navigate through that. But there are ways to navigate and to learn how to adjust differently using different techniques. So that's sort of, we can move past that. I know that a number of patients have come to me precisely because I'm a woman, because there is a perception that a woman is more maternal and going to listen, and all, again, perceptions of people. Doesn't mean we always are. No, I like to say that I'm known for that. And so I think there's a huge advantage there. My understanding is that there's more women now in school as students than there are men. And I don't like to make this women against men, because all males have a male, a masculine and feminine side, and all females have a feminine and masculine side. And so I will say that the world is your oyster, in the standpoint that if it's something you're passionate about, you're going to find a way to navigate through it. There's definite challenges for women having kids, and I have seen chiropractors go back to work within days of having children, and I've seen chiropractors take off years to be with their infants until they get to a certain age. And that is all navigatable. There's not one fixed way or one right way of having to do something. You can be in a partnership, an associateship, you can be an independent contractor, you can be an owner, you can be on your own, you solo, you can be with other people. There's all sorts of opportunities. And so my thing is, what I really want for people that are searching to be a chiropractor is you've got to be passionate about the ideals of chiropractic and the perspective of chiropractic. And if you're passionate and have gratitude for the things that you're learning, the people that you're seeing, I believe that you're going to be successful no matter what. And from the standpoint of women speaking on the stage, there's a lot of women speaking on the stage. And there are some interesting things. There are certain women that I absolutely love to watch because they've got jam-packed information, you know, information based, passionate, and storytelling capabilities, which make a speaker to me very, very interesting and memorable. There are some people that are speaking for, I'm not sure why they're on the stage. They're on the stage, but that I see that with men too. And so I think the key piece that I always look at for me when I've done a lot of speaking is, for heaven's sakes, don't hire me because I'm a female. Hire me because you think I'm good, right? I think if you hire me because I'm a female, I'm insulted, but that's just my frame of reference.
So, as far as the profession, you've been involved in it for so many years. Can you maybe just speak about even present moment or in the last few years, like where you've chosen to dedicate your time and energy, like where your focus is at, any groups you're a part of or that you've started or that you're facilitating, any projects that you're working on or organizations? I'm sure you're really involved. If you could maybe just touch on the different ways that you're involved.
Yeah, well, in the past, I've been involved, oh my gosh, association wise, regulatory, teaching. I've done all sorts of different things that way. In the last while, I've been working more now out of my home. My big practice, I sold many years ago to my kids, or my daughter and son in law are chiropractors. They took that over the big practice. And that afforded for me the freedom to do a lot of healing and a number of other things that I'd had injury wise in my life. And I work out of my home and see complex pediatric cases and complex pregnancies that are usually referred to me. And with the people that are referred to me, there's sort of one or two things that happen. One is I sort of sort them out and then let them go back to their original chiropractor. On occasion, I'll have some people that stay with me, but the concern, or not the concern, the caveat I mentioned to them is that there's times when I'm away because I do a lot of traveling and I do a lot of speaking. And I would say, then that's been incredible. That's been incredible. So much freedom with all of that. It's been really a delight, versus having to have the fixed 9 to 5, or well, I worked full days before. So that's afforded a lot of flexibility in my life, which I really was wanting at this point in time. I've got 5 grandkids, so it's nice to spend time with them, especially in the last 3 years with so many balls juggling in the air for their poor lives and the standpoint of school, no school, all that stuff that's gone on. Anyways, to be able to enjoy them more has been really, really remarkable as well. And then 5 years ago, I had a right below-knee amputation. So that changes things up a little bit. And I mean, I was seeing patients like, I think it was 18 days or 15 days. I have to actually check because I can't remember right now, after my amputation. So I wasn't down for long. And however, I still needed healing time and I needed to navigate things in new ways. And the old ways of me doing things, of, working a 9-hour day on my legs, just wasn't going to fly at this point. And this is what the beauty of the profession is, right? Is that you can go into different areas on making the practice of your dreams however you envision it to be. And so that's been busy that way. And then, I'm writing a new book called Soul to Soul. And I'm still downloading information on the chapters for some of that. So it's done, but not done. I keep curating it. I keep sitting on it. I start it back up again. And so we'll see whenever I have no idea when that's going to be ready, but it's about my journey in literally going from the sole of my foot to the soul of my heart, brain, and really moving those into a full different direction, which is magical.
Yeah, speaking of magical, I'm curious to get your point of view, our perspective, our feedback on this new concept of pre-chiropractic. Obviously, pre-chiropractic has existed unofficially in people's offices since the time chiropractic was started. Like people would go to their office and they would be like, "Oh, I want to do this," and there was a mentorship relationship established. And up until this point, mostly it's the schools' admissions departments that are responsible for doing the outreach and the promotion and working with chiropractic offices to really spread the word that this is a viable pathway. I'm just curious from your vantage point, though, if we were to create more intentional infrastructure and paint a picture that there's actually a field of study that's emerging of pre-chiropractic studies. I'm curious how that could maybe change somebody's trajectory, that could change the profession. Just curious what your feedback is on pre-chiropractic.
Okay, so I'm not that familiar with the concept of pre-chiropractic. If you're talking about sort of the mentorship of, yeah, explain to me.
I'll spell it out a little bit,
Yeah.
or I'll try and be as brief and abbreviated as I can. But basically, stage one is what is chiropractic? Why do people become chiropractors? Stage two is the inner state, so breaking innate up into your inner scientist, thinker, artist, teacher, entrepreneur, and the different skill sets and skill trees and expressions of chiropractic. And then stage three is the apprentice, where you're being able to go out and learn how to connect with the local office and make a structure to that experience, those observations, the getting adjusted, watching adjustments, seeing what a practice looks like from the inside out. Stage 2.5 is like the career pathways outlook, looking at all the different options and varieties of animal chiropractic or sports and so on. Stage 4 is start your own pre-chiro club. So having pre-chiro clubs sprouting up from students who have gone through a number of experiences and want to spread the message on their campus and really treating it like their first practice. Stage 5 is the capstone independent study project, where it's creative, but there's different prompts and options, but it could be like a science fair based presentation. It could be a speech. It could be a book, a term paper. It could be an online page of sorts, like a blog. It could be anything. Stage 6 is the admissions, which is where most students start. And stage 6.5 is that transition of identity from pre-chiro student into chiro student, and getting oriented to the campus they're going to and what the resources are that are available to them, so that on week one of chiropractic school, they can have some clear intentions, they can know why they're going to become a chiropractor, and they can make like some focused choices. Just putting that out there. I won't get into the rest of the program. The overarching program is become a chiropractor or become a chiro.
Right.
But the premise is if we're starting new schools in new countries, we need to have a proper runway or a proper contextualization of the profession in order to really lead somebody down the path in a way that they feel supported and also are able to sort of chart their own course, but are also guided to chart their own course.
Right, right. So first of all, I'm loving what I'm hearing, which is it's awesome and very detailed, and there's a logical flow to it. And what I would say that I've done in my personal life is I've spoken in a lot of sort of school programs. So, a teacher wants me to come in and speak about chiropractic. That's where I'm going to do my, I really bring sort of, well, I start off with the major premise and I do talk about, what it is that we're doing and how we go about doing it and what I love about what I do. Because I usually find when people talk about what they love about what they do, people can relate to that, or at least relate to the energy of it. And then the other piece I would say it would be through my patients over the years, is because I really like to educate my patients, is that I don't like to just tell them what to do. I want them to understand why we're doing what we're doing and what's the background behind it. So they come through in a very transformed way and have a much bigger expansion of where health really comes from, and how are we living our lives, and how chiropractic is a piece of what they're doing on a daily basis, and the way they may want to think and what they want to say and what they want to do. And so from that, I've certainly had over 15 patients become chiropractors over the time. So that is sort of, again, that mentoring piece that way. And I often think that it's really, in my mind, the best source is probably through our patients, because they've already had an experience, and chiropractic is very experiential, and that makes it much easier than someone academically just saying, I'd like to go into this profession. That was sort of like me, right? Is that I wasn't sure which way I was going to go, but my experience made all the difference. And I was still part of the cohorts where most of us as students came from being a patient or a family of chiropractors. And I know that can be very, very different now. So, I guess that's the sort of the piece that I look at is creating, yeah, that it is a mentorship and as you said, a pathway forward in the journey of going from point A, exploring potentially then chiropractic, and then navigating through that. And different people are different. I'm one of those people that I don't usually need a lot of external assistance and hand holding with things. When I've made a decision to do something, I'm doing it. I'm going to commit to it. I recognize that's not everybody. And I also recognize that there's a lot of other things pulling at people these days too.
Yeah, and we're just talking about structure and function, and we're talking about patterns. You mentioned you're looking at patterns and trying to connect the dots so that people can feel like there's a logical, nonlinear progression to their experience of life. And basically, that's all I'm trying to say is, if we use the metaphor that, couple of metaphors. One is that the primary subluxation happens either preconception or at conception, that the birth trauma is the first subluxation. Well, then this pre-chiropractic experience going into chiropractic school may be the primary subluxation of at least our education of chiropractic, if not the profession. But then also the metaphor that chiropractic calls you in, that it's a calling, that is not always necessarily a message or a stimulus or available to people in a college campus environment. I mean, it just doesn't have a presence or an existence. So like for me, I had to kind of just do a senior thesis project where I looked at all my options, and the chiropractor I asked was like, don't become a chiropractor. So I just had to keep searching, and eventually I stepped in the right chiropractic office on like the third office that I checked out. But I guess I'm just bringing it up that I would love to have there be like an intention set of, let's get a student started on the right path by making it easy for them to understand like what chiropractic is, what the pathway is to become a chiropractor, and how diverse the pathway can look, for their own unique interests.
Well, it's interesting with what you're saying. What comes to me that I inadvertently just say out of the blue when I blurt things out sometimes, meaning that they're not necessarily planned, is that there are certain, younger people that I'm adjusting, and students, and I say, you might make a really good chiropractor. Have you ever thought about that? And it's amazing how many light bulbs go on for them just posing the question. And I don't know how many that I spoke to that were my patients that became chiropractors as a percentage of when did I say that and whatever, right? But that would be in sort of an interesting thing. And I do say that with certain people, there's just a sense that, you like working with your hands, you're very creative, you're also very smart and academic wise. But you have to have that art and that science put together, because we perceive with our fingers, right? We're palpation, observation dominant profession, and you've got to have that willingness to serve. So I think, and I'm going to say a bit of an entrepreneurial spirit, because it's not like it's an easy pathway once you're out to get necessarily hired. So it's different from many of the other professions that way. And and I think just posing the question to people, and it's the same thing too in school. I would usually leave with the question saying, I don't know how many of you may just choose to investigate and become a chiropractor, but my door's always open.
And I'm sure you're aware there's not really a presence of chiropractic in the health centers on college or high school campuses. There's not really a mention of chiropractic very often in the kinesiology, applied physiology classes that you're in. So I was like a kinesiology pre-professional going in that direction of healthcare personal trainer on the side, massage therapy school on the side, and yet I wasn't even really pushed in the direction of chiropractic. And I'm not saying that everybody needs to be pushed in that direction, but I am saying that there needs to at least be that, like you said, that question of maybe you'd consider being a chiropractor one day. If people just heard that, I think more people would be attracted than repelled by it.
Yeah.
And if we're talking about reaching our full potential, sure, the profession is great as it is, but if we really want our next generation to reach their full potential, we need to use the wisdom of previous generations to really build a new model, not just use the old model and complain about how school is just there to get you a license and then you figure it out. But to say, like, before you even go to school, you need to kind of figure a little bit out so that when you get to school, you can really develop those professional level skill sets.
Right. Yeah. No, I'm in full agreement with you on that. There was something you said, but it floated. It was there and it's gone.
Reaching the full potential as a profession might have been one of the things that I mentioned. That I'm just curious because I know that you're always in conversations with chiropractors that are in positions of power and in influential positions, or you're speaking on stages and brushing shoulders with organizations and schools and associations that are concerned with progressing the profession forward, of strengthening our profession from within. If we're all about connection and communication and coordinated function, we can make the argument that we have the most fragmented profession in the world, that nobody talks to each other, that everybody's amazing in their own little pocket, in their own little tribe, and they're helping their own little group and community. But as an overarching community, we're really not leveraging each other's gifts and strengths, and we're not collaborating as much as we could. Would you agree, or what's your thoughts on that?
Well, I guess I would have to agree in many ways. And yeah, and I don't want to get too much into the politics of it. uh, yeah, sort of I have to think this one through and how I want to answer the or comment. I think that there are far more opportunities for us to use as chiropractors that are motivational, inspirational, curious questions with the public. I don't expect healthcare in general to do our work. I certainly know there's one big overarching profession that would never do our work, and it's not medicine. It's above that, because there's no vested interest for them in that. And so I think, again, I like to say we have to always look at self first. You always have to look at self first and say, where am I contributing to the problem and where am I contributing to the solution? And so I'm going to suggest then, if people have memberships in certain organizations, even as a member, is to float the question out as, what are we doing to mastermind with potential students? Like, one of the groups I'm with is the Alliance for Chiropractic in Ontario. And they have a student mentorship program. I think the United Chiropractors Association, I was just there a couple of weeks ago, I think they have a mentorship program. And so I think it's supporting those and lending your voice on, just as what you're doing is, what would you have liked to have seen when you were considering chiropractic, or what were the gaps that you saw or experienced? And yeah, I don't like the idea of having third parties doing our work for us, because I think the message there, nobody has more of a vested interest than a chiropractor for chiropractic. Let me put it that way. Okay. And so I think we have to do our own work with it. In my perspective, chiropractic's always grown from the inside out, not from the outside in. So it's for us to individually be responsible for how are we inspiring people to become chiropractors, and how are we contributing to the groups that are going to be, we can be in alignment with as well, to do the same. Yeah.
Absolutely. And then, just as we wrap up this conversation, thank you, by the way, for obliging me to just get some feedback from you on what my vision is. I'm curious what your sort of outlook is on the future, or just some things that you have as an intention for the next 5, 10, 20 years. Do you have a vision for the profession, for the contributions that you're making to make their impact in certain ways? Obviously, we're detached from the outcomes, but just as far as the intentions, I'm just curious what you can see into the future as being possible, maybe given your awareness.
Well, I think that there's a whole new level of people that are questioning health in general, and they're questioning where does health come from, and they're questioning how can I be responsible more so for my health? What do I need to do? And there's a birthing of a new consciousness, if you will. It's always been there. Let me rephrase that. There's a birthing of a higher level of awareness that we are responsible for our thoughts, which changes our chemistry, which changes our physiology and outcomes and things like that. And I think people are starting to go back saying, wait a minute, is what we've been doing really working well for ourselves, for my family, for my community, for my country and for the world. And so I think there's always opportunities, and there's conversations that I'm seeing happening now that I never saw before, right? And people are waking up to, or a certain percentage of people are waking up to asking new questions. And those are the groups of people that I'd be interested in anyways, right? Because those that aren't interested. I'm not going to spend time wasting their time trying to convince them on something that's not going to make a difference for them. So I think that from a long-term vision, I'm always hopeful. I'm always hopeful, because to not be hopeful, I guess the opposite would be despair. And I think that when we stay true to the understanding the principles and applying them in a modern day language with the science that we have and the best science we have of the day, and recognize we don't have all the science yet, but lack of evidence does not mean evidence of lack. It just means certain things, there's limitations in what we can say or how we may be able to express it, but that's fine. It can all get taken care of at another appropriate level. I think that there's lots of opportunities for the profession, and I think there is a groundswelling of many chiropractors saying, wait a minute, how did we get off this path? And so now they're getting more passionately involved with the next generation, and ensuring that there are stories that are told that are accurate, that allow people to understand the history, what was learned from that history, the impact of what we've had on people at different times and stages in the profession. And yeah, I think that there's huge opportunities, and there's some clarity. It's like what BJ said, is conflicts clarify, right? And so I think that, yeah, there's always room for the person that loves what they do and do what they love and do it with grace, and they do it with passion, and they're good at what they do. There's always room for that type of person, no matter what. And no one can convince me otherwise.
Sweet. Thank you so much for sharing today with any prospective students that get a chance to listen to your message and can kind of just digest it and make what they can of it. And there's so many details to tease apart from this conversation. So thank you for showing up for the next generation. And we really appreciate everything that you've done to contribute to chiropractic and just, yeah, to the world.
Thank you so much. It's been a delight and opportunity. And thanks for calling me up to do